Why does probenecid affect gout differently at low doses? Imagine trying to turn on a light with a tiny switch. Sometimes, the switch isn't quite enough to get the light to turn on. That's similar to how low doses of probenecid work in managing gout. Probenecid's main role is to help the kidneys get rid of uric acid, which is the main cause of gout. It does this by blocking specific transporters in the kidneys called organic anion transporters. These transporters normally reabsorb uric acid back into the blood. When probenecid blocks them, more uric acid is excreted in the urine, lowering blood levels. But at low doses, this blocking effect might be too weak to make a big difference. If the dose is too small, it may not inhibit enough of these transporters to significantly increase uric acid excretion. That means the blood uric acid levels stay high enough to still cause gout attacks. Another important part of how probenecid works involves its anti-inflammatory effects. It can block channels called pannexin 1 channels, which are involved in releasing ATP and activating inflammation pathways called inflammasomes. These inflammasomes contribute to the swelling and pain during gout attacks. At higher doses, probenecid more effectively blocks these channels, helping to reduce inflammation and prevent gout flares. But at low doses, this anti-inflammatory action is minimal, so the medication mainly focuses on uric acid removal, which might not be enough to control symptoms fully. The effectiveness of probenecid at low doses also depends on how it moves through the body and how well the kidneys function. If someone has kidney problems, the drug may not reach enough of the transporters to have a meaningful effect, especially at lower doses. That's why doctors usually start patients on a smaller dose, like 250 milligrams twice daily, and gradually increase it. This approach helps find the right balance to lower uric acid effectively while minimizing side effects. Drinking plenty of water is also important because it helps flush out uric acid through the kidneys as the medication begins to work. In summary, the reason probenecid affects gout differently at low doses comes down to how much it can inhibit the urate reabsorption in the kidneys and how much it can reduce inflammation. At low doses, these effects are limited because the drug's concentration isn't high enough to fully block the transporters or inflammasome activation. That's why careful dose adjustment and monitoring are essential in managing gout with probenecid. Always remember, individual kidney function and overall health play a big role in how well this medication works, so it's important to work closely with a healthcare professional for personalized treatment.